Hi, my name is Tiffany McAnally. I've been a nurse for 15 years now, and I work in Pensacola, Florida. I'm doing my project on compassion fatigue. The facility that I am doing my practicum at is Select Specialty Hospital. It's considered a long-term acute care hospital. They have patients that have gone into multi-system organ failure, are still ventilated. We have a lot of trach patients. They come from acute care hospitals because they are still too sick to go home to or to rehab, so they come to us. We did have a lot of patients that contracted COVID-19. They had a lot of trouble with weaning from the ventilator, so that's why we had a lot of patients trach vents. And some of the other patients are just requiring high levels of oxygen and are on vapotherm or high flow nasal cannula, and which cannot be used at other facilities. The learning goals that I have are to educate the staff about compassion fatigue, let them know what the signs and symptoms are so they can recognize it in themselves and their coworkers. Also, letting them know the effects that it could have on patient care, and I hope that it gives them the confidence to feel comfortable talking about their feelings. And I want to be able to provide emotional and supportive services for them. Learning objective number one is to perform an accurate assessment of the effects of compassion fatigue during the pandemic. Uh, to do this, I worked with my preceptor, and I looked up information about compassion fatigue. We discussed it, and during our discussions and our observations of the staff, we were able to recognize that a lot of staff seem to have some of these symptoms. One staff member that my preceptor noticed, she was really not being herself. She was a lot more outgoing usually, one of the happiest ones whenever she come into work, and she had become isolated, withdrawn, very quiet, just not her normal attitude. And after a little bit of observing and talking with the nurse, we found out her father had COVID and was doing poorly with it. So she was coming to work and being reminded of COVID constantly because that's what we were dealing with at the time. All of the patients, it seemed, had contracted COVID, whether they were doing good or not. It just depended. So her work was not being left at work. Her home life wasn't being left at home because it all ran together, and it was difficult for her, and she became fatigued. Learning objective number two was to develop a plan to educate the nursing staff on ways and signs and symptoms of compassion fatigue. I made some educational material to educate the staff and administered that to them during our annual education days. I kind of lucked up in being able to do that. I had a booth and was able to educate all staff members on uh, compassion fatigue, because not only nurses were suffering, but the physical therapists, occupational therapists, CNAs, all the way up to management. Really, everybody had some effects of COVID in some way or another. Some of the symptoms of compassion fatigue is loss of purpose. Um, a common one was sleep disturbances, emotional roller coasters and anger, self-doubt. A lot of people have doubted whether they're being a good nurse or not because they're unable to save the patients. The COVID pandemic has put a lot of stress on doctors and nurses on how to care for patients properly, and with the high mortality rate, it has been difficult for anyone to feel like they're doing a good job. Learning objective 3 was to discuss the appropriate staff education regarding compassion fatigue. So during my discussions, I also gave them information on webinars that they could attend and other educational links that I thought were pretty good. I discussed it with my manager. She also thought it was a very good time to make this happen, and had also been seeing it look like that there was a lot of compassion fatigue amongst the staff. This is the webinar video link that I found. It's a very good webinar. She explains compassion fatigue, all the signs and symptoms, and also has a plan developed at the end. You do like a self-planning thing to start taking care of yourself to decrease the risk of compassion fatigue amongst yourselves. Literature comparison. Healthcare workers are one of the major groups that are affected. Compassion fatigue is really prominent in critical care nurses all the time, but with the pandemic, it has increased to everyone because everyone has had some type of effect, whether it's a personal effect or not. During the pandemic, a lot of our staff seem to be struggling with the increased number of deaths. As a nurse manager, I feel like we should be more compassionate and inspirational leaders to try to support the staff through respect and role modeling and help increase the morale. And I feel like that's something that my facility that I was at lacked. It doesn't seem like the staff seemed to have enough support, and you could tell that they didn't feel like they could go to management for really any of their concerns. So that's something that we need to work on. Best practices involve number one, self-care. Self-care is probably the most important thing to help decrease the effects of compassion fatigue. A lot of us put ourselves on the back burner. We put our job, family, even friends ahead of ourselves. So we need to make sure that we start taking care of ourselves. It can just be getting massages, nail care every 2 weeks. Something simple, but it's for us. Setting emotional boundaries. Make sure that you are not getting too involved with certain patients and their life. Make sure you leave work at work. Engaging in outside activities. Same thing as self-care. You need to make sure you're doing activities that you want to do. You enjoy doing stuff with your family, but sometimes you need to do something for you. That could be running, exercising, anything, playing softball, flag football, anything that you enjoy for you to get your mind off of work and life. Positive coping strategies. That could be things like meditation, relaxation, talking with friends, going out with friends, stuff like that. Workplace strategies also can be making sure you get regular breaks. Make sure you ask for help. A lot of people are ashamed to ask for help, but everybody needs help every once in a while. Therapy. This could be a personal therapist or a workplace therapist. Not all facilities have workplace therapists, but hopefully you can get help somehow, or at least find a way to get help. Talking with your manager. Make sure that any concerns that you have, you talk with your manager, whether you feel like it's going to make a difference or not. Sometimes you just getting it off your chest makes a difference and will help keep you from becoming fatigued. My hope is that during the practicum that I have had an impact on my coworkers. I know I did talk to one the other day to see how she was feeling, and she discussed with me that she had seen that she had changed in the way she was taking care of her patients, that she used to enjoy just doing patient care. Recently, she's been in the room, out the room, doing what just has to be done, not really spending any time with her patients. And she had noticed that that's not the nursing assistant that she had always been, and that she needed to change something. She needed to relook at stuff. She had been overworked. So I think some of the information that I have given the staff has been helpful, and I hope that it continues to help them. I know I looked at myself in the same way, and I myself have gotten to where I didn't want to go to work. I felt like I wasn't being useful at work. The staff, they always respond to me well, but I don't know that I, was helping them, improving on their morale. And so I have some stuff to work at on as a supervisor, and I hope they'll continue to work on themselves. Self-care, promoting it between my staff and myself. I know I do put myself on the back burner a lot, and I intend on changing that a little bit. And I want to make sure my staff do the same thing. I want them to take care of themselves. I also want to be able to say, you need a vacation. You need some time. You're starting to get short with staff. You're starting to get short with the patients. We need you to do the best you can. And right now, you're not. So you need to take some me time. And I want to be comfortable in doing that and letting my staff know that it's okay. It's okay to take time off. It's okay not to be here, that, your job and patients will be here when you get back. So we need to all work on ourselves, make sure that you're looking for it in each other. And I hope that any information that you got from this is helpful for you. I know it's helped me and some of my coworkers. So I wish you good luck. Thanks.